Hi there. Welcome to the program, Your Doctor in COVID. I'm Dr. Mahendra Karpan, Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. Today we'll be continuing a series of programs looking at questions sent in from our viewers and listeners regarding the COVID-19 infection. As you can see or you can hear, I'm wearing my mask, and it's covering both my nose and my mouth. And for the purposes of this episode, I will take it off because I'm alone right now while we are recording, and there's no one here to put me at risk, and I'm putting no one else at risk. So here is a question that came from one of you, and it says, can I become infected from touching a bottle, or drinking from the bottle, or from ice? Very interesting question, because we are all at some point going to touch surfaces. We're going to drink from a bottle or a glass, and it's important for us to know our risk so that you can minimize and take precautions when necessary. So, basic fact: transmission of the COVID-19 or the coronavirus is mainly from person to person, and this occurs in two forms. In large droplets, for example, when someone sneezes or coughs, or there's smaller particles called aerosol, and these, however, can last longer in the air and they can travel further. However, there is still a lower risk of transmission from surfaces that you come in contact with than the risk from transmission person to person. So the risk is possible to transmit from surface to person, but that risk is lower than person to person transmission. When you touch an infected surface, you may then touch parts of your face, including your mouth, nose, and eyes, and these are portals through which the coronavirus can actually enter your system. Remember, if you have questions, feel free to WhatsApp at 620-MASK, that's 620-6275, or send your emails to docandcovid@gmail.com. Important fact to note that the coronavirus can live for hours to days on surfaces like countertops and doorknobs, and how long it survives actually depends on the surface material. And we look at a couple of common surfaces that we come in contact with, things like paper, cardboard, wood, cloth, stainless steel, etc. So let's look specifically at metal surfaces, okay? And metal include simple things like your doorknob. When you're opening the door to go in or out your house or your office, these are examples of metals, the doorknobs, your jewelry that you put on, the silverware that you use to eat in the kitchen or in the dining room. Now on metal, the virus can survive up to 5 days. On wood, for example, your furniture, decking, or even wooden kitchen countertops, this can allow the virus to survive up to 4 days. And if you come in contact with a surface within that period that is infected, you can then transmit that virus from the surface via your hand to your face and your mouth, nose, or eyes. Okay? So remember that. Another type of surface that we come in contact with commonly is things like plastics, These include juice and juice bottles, detergent bottle. This is specifically related to the question that was asked. Other things that are common in Guyana when people are sitting down in public transportation, for example, the bus seats, a lot of them are covered with leatherette and those kind of surfaces. And you know, in this condition, the virus may survive about 2 to 3 days, which is why it's very important for the owners and the conductors to keep the bus seats quite clean and to sterilize and wipe off after every trip. It may sound like a lot, but it will save lives and reduce the transmission. Stainless steel. These include refrigerators, pots and pans, your sink, some water bottle. A lot of people these days may have these portable water container that they can keep their water cool or keep tea in it that is hot. And these are made of stainless steel or sometimes aluminum. And it's possible that the virus can stay on these surfaces for about 2 to 3 days. Okay, so that's very important to note. What about glass? This is another surface that we come in contact with a lot. Drinking glass, measuring cups, mirrors, windows. The virus can survive up to 5 days on those surfaces. And ceramic dishes and pottery, mugs, for example, another 5 days. And paper, example, your newspaper, the mail, even toilet paper. The length of time here, however, varies, but it can last, or the virus can survive on these surfaces for up to 5 days. Cardboard. Many of us like to order things on Amazon, and we like these packages when they come to Guyana. We're excited when they're opened. But shipping boxes, we can have viral survival for up to 24 hours. Things like money, a coin, which is made primarily of copper, the virus can survive on that surface for up to 4 hours. Aluminum, which makes a lot of the soda cans like the Coke, Sprite, all of the soft drink that we love to enjoy. The virus can survive on those kind of surfaces from 2 to 8 hours. What about foods that we eat? Again, these are all surfaces that can harbor and allow the virus to survive. Things that we love to have to go or take away food ordered from various eating establishments. And right now, when there are restrictions on indoor dining, many establishments may offer the takeout option. And this is something that, you know, it's highly dependent on the sterilization and the sanitation practice of the establishment that you're buying from. And they can allow viral survival on these surfaces, and it can actually be transmitted to the human body. However, coronavirus doesn't seem to spread significantly through the actual food, because one assumes that there is a process of cooking and heat and stuff that has been applied. In terms of water, the virus has not been found in drinking water. Bear in mind that a lot of drinking water is actually treated water, and there are chemicals that are put in the water that makes it clean and makes it suitable for human consumption. So we have not been seeing cases of transmission from consumption of water. What about clothing, things that you wear? Fabrics, clothing, linen. There's not much research about how long the virus lives on fabric, but it's probably not as long as hard surfaces like metals, countertop, and wood, etc. So these are some very, very important facts to bear in mind when you're thinking about, resuming normal activities of daily living, where to go, what to buy to eat, what to drink from. And these are very important questions that were raised by one of our viewers or listeners. Now again, let us look at the shoes that we wear and walk around. There is a new move or a recent move for the soles of your shoe, the bottom of your shoes, to be sprayed when entering certain establishments. And even if the shoes are not sprayed, there is a surface, a mat, which is usually wet with some kind of detergent or sterilizing agent for you to step on before you enter the building, enter the room, etc. And why is that so? Well, this started out from a study that was done in an ICU in China. And it showed basically that in the ICU with COVID-19 positive patients, about half of the patients or half of the staff whose soles of their shoes were checked were found to be carrying the viral particles or the RNA detected by testing. One important thing to note there, that's in the ICU where the sickest, most severely affected patients are. As they moved away from the ICU and continued checking the shoes for staff members, on the wards where there are less sick patients, the shoes showed less viral particles and less number of those were positive. There is no research yet on the skin and hair to show exactly how long viruses can actually survive on your skin or on your hair. So these are all important surfaces that we need to know how the long viruses can survive. So when we are going about trying to plan how to sterilize our surroundings and our areas, the main areas to really focus on are things like your countertops, your tables. Right now I'm actually in studio and you may see, or I'm going to tell you that my elbows are actually on the countertop here, the table, but I'm actually wearing a long sleeve shirt. So perhaps that will reduce my risk. But not everyone will be wearing long sleeve shirts. Not everywhere is cleaned to the same standard that we may encounter each individual. So countertops is very important to clean. Tables, doorknobs, especially in buildings and areas that a lot of persons are coming in and out of, it's important to clean those doorknobs. Bathroom fixtures, people go into the bathroom, they wash, they clean, and sometimes you touch things before you actually clean, and then you touch them again after you would have washed your hands, and then that starts the process of contamination all over again. Phones, we all find ourselves often on our cell phones, and lots of people may be calling us. Sometimes you're not always mindful of putting it back in your pockets. You can put it down on a table, you can put it down on a countertop, and it can become infected. Public phones where more than one persons are using, that can also pose a risk. Keyboards, remote controls, and of course public toilets, these are all areas of risks that one needs to be cognizant of. The specific question about ice is an interesting one, but here is what the WHO says about eating frozen foods and ice, for example, ice cream, etc. There is no scientific evidence that eating hygienically made frozen food and ice cream spreads the coronavirus. So again, it's not the ice or the ice cream itself, but the process that it goes through to be made edible or usable. If you use contaminated water, you'll have contaminated ice. If you use clean water, you'll have clean ice. So it's a very simple, straightforward thing. And how do you wash and prepare foods or fruits, for example? Wash them the same way you would in any other circumstance. Before handling them, wash your hands with soap and water. Then wash the fruits and vegetables thoroughly with clean water, especially if you're going to eat them raw. So I hope this answers the questions about drinking from a bottle and potential for being infected using ice. Again, if you have questions, you can WhatsApp to 620-6275 or send email to docandcovid@gmail.com.